Hi, I'm Shannon.
And I'm Nancy.
I'm Marilyn.
I'm Aaron.
I'm Chrissy. And
we
got your back!
Do not avoid the facts. A loaded backpack should not weigh more than 10 to 50% of your body weight. Heavy loads carried by more than 79 million students across the United States can cause low back pain that often lasts throughout adulthood. Experts also estimate that as much as 80% of the population will experience a back problem at some time in their lives.
Understanding the anatomy of the back is essential for a client with lower back pain. If you look at our buddy Mr. Bones here, he has a perfect S-curve neutral spine. If you look at the vertebral column, it's made up of the vertebrae and intervertebral discs. When you're leaning, bending, and twisting and reaching, you're putting pressure on these discs. And so it's important to have a neutral spine when you're sitting or standing to reduce that pressure.
so when shopping for a backpack, you should really keep these things in mind. Make sure you buy a backpack that is size appropriate for your own body, along with buying backpacks that are thick in the strap and padded as well. You should also keep the straps as tight as you can, just like that, to avoid more pressure on your back. If you look at these pictures right here, you can see the right way and the wrong way.
And here are a few simple tips to prevent back pain. 1. Wear supportive shoes when walking around campus. 2. Avoid sitting for long periods of time. Get up and take a walk. Exercise. Research shows a stronger core can help with good posture. 4. Sit up straight. You don't want back pain now. Use proper body mechanics. Do nightly stretches. And invest in quality sleep, whether that's buying a good pillow or a mattress pad. Go out and get one. You'll never regret it.
So there's a couple different ways that you can prevent back pain and manage it. You can use different types of stretches, which we're going to show you coming up. And then one thing that always helps is using maybe a roll towel, something like this, or a lumbar roll. And you can place it right here on the back while you're sitting at a chair, studying, or if you're driving, and that alleviates some of the pain. You can also use hot or cold packs if you have them, and just make sure you have correct seating posture. A trick to that is like keeping 90-degree body mechanics. In the elbows, when you're typing, you want to keep those at 90 degrees. When you're sitting, keeping your knee at 90 degrees, and just making sure your head is straight up, shoulders back, stuff like that, and it'll all help. You'd be surprised.
Alright, so the first stretch you can do at home is called a knees to chest stretch. And the benefit of this stretch is it stretches out the spine and also relieves tension as well. So what you can do is start off laying on your back, and you're going to do one leg at a time. So you can start with the right leg if you like. You're going to pull your leg gently to your chest, hold for 10 seconds, get a good stretch, and then you can repeat that 3 to 5 times on each leg, and then switch over to the left leg. Very good. So hold for 10 seconds. And then once you're done doing each leg 3 to 5 times, you can pull both of your legs at the same time to your chest, hold tight, and get a good stretch in so you can feel the stretch in your lower back and your hip. And then you can release, and you should feel some relief after that.
Alright, so our next stretch is called the Cobra. The benefits of this stretch is to decrease stiffness in the lower back. So we're going to have our wonderful model here lay on her stomach, where her palms face down by her rib cage. She's going to straighten her arms and put yourself all the way up with her chin up. You're going to take a deep breath, exhale, inhale, exhale, and do this for about 30 seconds. And repeat as needed.
So we're going to be doing the child's pose today. The child's pose helps with your ankles, your thighs, and your hips, and it stretches out your lower back and relaxes your whole body to help reduce fatigue and stress. Okay, so how we're going to do this is I want you to go on your knees. Perfect. So now that you're on your knees, I want you to spread your knees apart, have your big toes touching, and you're going to relax your buttocks on your feet. And I want you to lean forward, and you can stretch and place your head down on the floor. You want to have your chest touching your knees. Perfect. And if you want, you can put your arms back behind your knees. Perfect. If that's more comfortable for you. Nice. And so now you can hold that for as long as you like until you feel that you had a good stretch. Okay.
So if you continue to experience pain and a bunch of the techniques that we've talked about aren't working for you, you can go see a couple different medical professionals. The first person you can see is a chiropractor. They will give you quarterly readjustments to free your body of knots that you may feel in your back. You can see a massage therapist and they'll do deep tissue massage. You can see an acupuncturist and they relieve pressure at trigger points. You can see a physical or occupational therapist and they will focus on ergonomics, body mechanics, and ADLs. And then you can also talk to your primary care physician and they may refer you to have pain medication management or back braces.
Prevent.
Manage.
Seek help.
Take action now.
Your back will thank you.